Okay, you guys, so today we're going to be talking about the reason why you may need to mobilize the first MTP joint, either distract it or mobilize it into a dorsal glide. And in a minute, you're going to see a couple compensations of how that might present itself if you have a first MTP joint that's stuck more neutral or plantar flexed and doesn't have adequate dorsal glide. During gait, you need about 50 to 60 degrees on average, maybe a little bit less, maybe a little bit more, just depending upon what your function is. So what you can do is take a goniometer and measure along the metatarsal here, and then the distal phalanx as well, just to see if they do have that 50 to 60 degrees. But what I want to show you today is a technique to basically unlock it and then do that dorsal glide and why. So what I see presentation-wise with this is that a patient may show a foot that's overpronated. And typically what we do teach in our Great Lakes Seminars classes is when you see an overpronated foot, that usually is a resultant of a lack of ankle dorsiflexion, which is absolutely true, and that would be the first location I would look to treat, is the ankle and getting it back and working in the sagittal plane. But another reason why someone could have an overpronated foot is because of a lack of first ray or first MTP motion as well. So one of the compensations would be a gait pattern that looks like a medial heel whip. All right. So a medial heel whip is going to look like this. On my left foot, instead of pushing off through the very tip of my great toe, as they come into that terminal stance to pre-swing, they're going to spin off the inside of their MTP and then their toe and then push off. Okay, so again, they're going to do that. I'm doing it slowly so you can see it. Okay. And then in real time, it's going to look like this. So my left foot. Okay. So that is, again, the first MTP joint, not dorsiflexing as the foot comes up over top of it, and instead they compensate into that transverse plane. Okay. And then another compensation pattern that you would see would look like a squat with kind of a toe raise, where the person is essentially plantar flexing their first ray, but they're not keeping their first toe down. So as they start coming down, they start to lift the toe, okay? And all that is, they're actually not dorsiflexing at the first MTP, they're plantar flexing at the first ray, okay? So in order to maintain adequate toe stance as well as dorsiflexion, we really want to gain a little bit more dorsiflexion through the first MTP so that we don't have hypermobility or excessive first ray plantar flexion. What would happen is if you don't and you have just excessive first ray plantar flexion is ultimately their foot would fall into pronation because you don't have an adequate windlass effect. Okay, so again, just watch for that. If they start to squat and then you see a first MTP lift, think I need to decrease first ray plantar flexion and increase first MTP dorsiflexion. So the treatment for that would be stabilizing with your thumb, right, at the metatarsal head. And then you're going to grip, I like to use this grip, okay, at the proximal phalanx. And then you're going to distract. You're going to distract and then dorsal glide without allowing the first ray to plantar flex. So I'm blocking the first ray from plantar flexing while I'm distracting and doing a dorsal glide of the first MTP joint. Okay. Off his body, it looks like this: stabilization, distraction, and dorsal glide. The really interesting thing about this joint mobilization with the great toe, this this joint gets compressed a lot. It's almost like if people stub their toe, or just, again, based off fascial tension and muscular hypertonicity around that joint, it just tends to get locked up, and it doesn't get all the mobilization that it needs all the time. So it is really important to do distraction and the glides so that we basically bathe that articular cartilage in all that synovial fluid. It's one of the indications for joint mobilizations, is to increase lubrication, decrease pain, increase joint extensibility, and also increase joint nutrition. So when we're doing the distraction and glides, or distraction, compression, kind of like pumping, we are also allowing that synovial fluid to just go all the way around that whole joint surface inside the capsule, so that it just gets more lubrication, and then suddenly the joint starts moving better. Okay. So again, on the foot model, it would look like block at the first ray. Okay. And then you're going to distract and then dorsal glide. Okay. A lot of times you want to make sure that you are just sustaining. Okay. This one takes typically about 2 minutes or more, and you'll feel that glide just suddenly start to increase. Okay. But just hold that distraction and hold the glide.